Welcome to today's Dentistry with Dr. Blanche Grube. On this installment, Dr. Blanche will introduce you to two of our Centers for Healing doctors.
Hi, I'm Dr. Blanche Grube, and I'm here to welcome you not only to my website, but to introduce you today to two new doctors. Oh, I got to take that back. They're really not new doctors. They're just new to our practice in Scranton, Pennsylvania. Actually, even Dr. Vinny is not that new. So he's my first guest that I'm going to introduce to you today. This is Dr. Vincent DiLorenzo, who, like I said, is not really new. You were practicing with us 5 years ago?
Yes.
So he was practicing with us 5 years ago, but that was before I, had this epiphany and decided to open up Centers for Healing. And so when I shared my vision with Dr. Vinny, and by the way, in our office, we call everybody by their first name because it gets confusing. My husband is a doctor, so he's Dr. Grube. I'm a doctor, I'm Dr. Grube, so it's Dr. Grube, and it gets kind of crazy. So we call him Dr. John, we call me Dr. Blanche. He's Dr. Vinny, and so it makes it a lot easier. Anyway, Dr. Vinny DiLorenzo was working with me 5 years ago before I had the vision for Centers for Healing. And when I told him about my vision for Centers for Healing, he certainly wanted to be part of it. So I'm very pleased today to introduce you formally on the website to Dr. Vincent DiLorenzo.
Thank you, Blanche.
Yeah, I'm glad to have you.
Dr. Blanche.
I'm glad to have you back on.
It's nice to be back.
Yeah,
it
I'm really happy to have you back on board.
Thank you.
Yeah, it's wonderful.
It's actually an honor.
Wow.
For me to be working with you again.
Thank you very much. So why don't you tell our listeners, because they don't really know you the way I know you. Why don't you tell our listeners a little bit about yourself? Number one, where'd you go to dental school? Actually, where'd you grow up?
Wow, Bergenfield, New Jersey. Bergen
He's
County.
a Jersey boy.
I'm a Jersey boy, and I grew up there. And I wound up going to college in Hofstra University in Long Island.
That's in Long Island with a G. Long Island. You have to say it right.
That's right, Long Island. And I wound up at Temple Dental School, and I graduated in '76.
That's 1976, not 1876.
Very long time ago.
That's still a long time ago. So
Right.
you've been a practicing dentist for quite a while now.
And that's where I met my wife and partner, Andrea Brockman, who we opened up a dental practice in 1979 together in Philadelphia.
Okay.
I moved from northern New Jersey area to Philadelphia.
Because that would be a long commute.
It would have been a very long commute.
That's a long commute.
So we opened up a practice, and it basically was a conventional practice until probably 1985.
Okay.
And it's very interesting because that's probably where we met Dr. Blanche, and it was at a conference, and I wasn't able to go. But Andrea had gone.
That's right. I met Andrea first.
Right, and I think you were riding around on a golf cart. And she calls me that night, or I speak to her that night. She says, I met this incredible person. Her name was Blanche Grube. I said, oh.
You sure that's what she said?
Yes.
I met this crazy lady.
Well, that she also said. That she also said.
Okay.
But, she said, met this incredible person, and I have something to tell you about dentistry when I get back. So she came back a few days later, and that was the first time I had heard about mercury in dentistry, which it floored me that, there was something wrong with mercury, and she brought back all these books and tapes, and she said, you have to listen to this. I said, no, I don't think so.
I don't think so.
I don't think so. I'm not going to...
Don't rock the boat.
Don't rock the boat, because don't go there. Well, after about 3 months, and it took me that long, I started reading. And from that point on, everything changed.
Right.
Our lives changed, our practice changed. And we really began in earnest of a holistic type dental practice,
Right.
probably beginning in the maybe 86, 87.
Oh, so you had a holistic dental practice way back in 1986,
Yes.
87 in Philadelphia.
Yes, it wasn't following Huggins protocols at that
Okay.
time. We learned later on about Huggins' work through
Right.
through all our studies, but we were totally shocked by everything we learned in dentistry was wrong.
I know.
From
I'll
fillings,
tell you,
yeah.
I can relate to that because the first time I sat in Dr. Huggins' class and he talked about how toxic mercury was and how it really did come off the fillings. You know, we were taught in dental school it did not come off the fillings.
Correct.
And the first time I heard it, I sat there going like this. And one of his workers came over to me and said, "Blanche, what does this mean?" And I said to him, "Can't you hear that?" I said, "Those are the cannons going off in my brain." Because everything that I was taught in dental school, almost everything,
Right.
turned out to be incorrect.
Correct.
And so it is. It's a mind-blowing experience, and it's a life-changing experience.
Yes, it was definitely life-changing, and it was life-changing for our patients.
Right.
And we started really realizing the work we were doing was really helpful. It was
Right.
really saving people's lives.
Right. Now, didn't you try to retire about 5-6 years ago?
Yes, tried to retire. Well, Andrea, unfortunately, in spite of all the precautions that we took, and we were pretty well equipped, she still became mercury toxic.
Right.
And her toxicity led to our really leaving
Leaving the practice.
altogether.
As many dentists do.
Yes.
As many dentists do. We either have to retire early
Yes.
or we commit suicide.
It's terrible. Dentists are
Yeah, one of the
exposed
two.
to tremendous amounts of toxic materials, and
Right.
and dentists have to protect themselves along with their patients as well as their staff.
All right.
So that was something that we had to leave.
All right.
And she's still struggling with mercury
some of her issues.
with mercury toxicity issues.
As I do every single day of my
Right.
life.
Yeah,
Absolutely.
And so do I. And we've
Yeah.
been detoxing for years. I don't remember when we weren't detoxing.
All right.
And so we left and kind of tried to do different things and floated around. And dentistry always, held a special place in my heart. But there's nobody practicing dentistry.
There's nobody practicing dentistry the right way.
The right way.
That's right.
And I would have to say that a number of years ago I was lucky to be able to work with Dr. Blanche at that point. And as I mentioned, it's an honor to work
Thank
with
you.
her. And I consider Blanche and the protocols that are used as purest.
All right.
You are.
Oh, yeah.
We
Thank you.
we are doing like the
Thank you.
very
I've never heard
best.
that one. A purist, huh?
The very best you could do
Absolutely.
in dentistry. And I'm
So
really
you know
honored
that
to be-
really that's an important point, and that's something that I really want to stress to our watchers and our listeners, that you might come to one of the Centers for Healing dental offices and suddenly be surprised because Dr. Blanche is not actually doing the dentistry on you. I really do want to stay in the dental profession for another 20 years, and the only way I can do that is if I stop doing the drilling and filling myself. So it's a difficult situation for me because I need to pick somebody who is younger than I am and is still working, but at the same time has many years of experience. And that's a very fine line to travel. And I've been fortunate enough to have some very fine dentists working with me now who have the experience, who know what they're doing, and at the same time are just slightly younger than I am, and they're not quite ready to retire.
That's true. I'm not quite ready to
Not
retire.
quite ready to retire. So we are really very fortunate to have Dr. Vinny working with us in the Centers for Healing Scranton. My plan is eventually to open up Centers for Healing in Philadelphia, and he'll be working in that office also, if I can keep him healthy and alive and still working. That's my goal. Anyway, so this video was basically to introduce Dr. Vincent DiLorenzo so that he would be a familiar face to you when you come into the office. Not just our Scranton office, but any of the Center for Healing office where you might meet other dentists that may not necessarily be me, because they don't look like me, but you can be rest assured that they practice just like me. That is my goal, to make sure that every Centers for Healing dentist practices the way Dr. Blanche would do it, which really very much is the way Dr. Huggins would have done it.
It's a wonderful concept.
Right, right. And today I have the privilege and the honor to introduce you to another doctor who is going to be working with us in our Scranton office. This is Dr. Huguette Duteau. She obviously has a French background. You know, sometimes that's not so obvious. If you look at my maiden name was Durand. So my name was Blanche Durand, and some people would say it very French.
That's very French.
Blanche Durand.
Yes.
I'm not French. I don't know where my parents got the name, but I'm not French. But you do have a French background, correct?
Yes, yes. I was born in Haiti, and I grew up all over the world, and eventually we landed in New York City when I was in my teenage years, and we've been staying in the States ever since.
You speak French?
Yes, I speak French fluently, and I speak it to my kids too, so I pass that on to them.
Very good. Say
Yes.
something in French to me.
Bonjour, comment ça va? That's very basic.
I know how to say croissant. Okay.
Croissant?
Gluten-free croissant. Thank you. Thank you very much.
Ouais.
So what dental school did you go to?
I graduated from Howard University School of Dentistry in 1989.
Okay, that's in Washington, D.C.?
In Washington, D.C., right.
Very good.
Yes.
1989, you said?
Yes.
Oh, so she did not graduate the day before yesterday either. And I have said this in other videos, that most of the dentists that work at Centers for Healing have experience. They're not dentists fresh out of dental school. Although we do have a dentist, Dr. Colin who is fresh out of dental school. I believe he's been out maybe less than a year, but he's an old soul. He practices as if he's been practicing for 10
I've
years.
met him.
Yeah.
Yes.
So it's a lot of fun now in the office, because we have Dr. Who and Dr. Huguette, because we tend to call people by their first name. Dr. John says we should get Dr. Huguette, so we would have Who, Huguette, and Huguette. This is just a little joke. Anyway, so you graduated from Howard University. You were a conventional dentist when you graduated.
I was. I was a conventional dentist, and I have a daughter who has a disability. As a result, I've been looking for different modalities for helping her and making her health better. As a result, I was in contact with a lot of naturopathic doctors, and they're the ones who got me to be aware that amalgam was toxic to your health. They would tell me, you know that mercury filling is bad for you, and I'm like, really? Thinking back in those days, I'm thinking, really? I really didn't. It took me a while to believe it, because in dental school, this is what you were taught. And I figured if they teach it in dental school, then it should be fine. Right. Anyway, over a long period of time and a lot of reading and studying and listening and following different roads, I came to hear about Dr. Huggins. And this is how I met you, Dr. Blanche.
It was at a Huggins training?
At a Huggins training. Okay. I was impressed with you. And when I saw you, I said, when I grow up, I want to be just like you.
Hopefully not as big as me. Okay. You're a little shorter than I am, so don't go there. Okay.
Yes, I was really impressed with the knowledge and the professionalism, and everything sounded true. Everything sounded true to me, so it was very easy for me to incorporate it in my life.
That's interesting. You know, you said when you hear truth, there's something inside of you. Your soul tells you that yes. this is exactly where you should be.
Exactly.
Absolutely true.
Exactly. And that was about 10 years ago. And I am so honored and excited to be part of this group now, because this is what I would have always dreamed for.
Right. My dream is to have Centers for Healing all over the United States, so that patients know that there is at least one place that they can go to where they're not going to be offered a root canal, where they're not going to be told, don't worry about it, you can just put a whole bunch of implants in your mouth, where they're not going to be poisoned, just because it's the protocol, just because it's the standard of care, just because all the other dentists are doing it, therefore you're going to have this literally shoved down your throat. Your children are going to have fluoride shoved down their throat, whether they want it or not. Your children are going to be given stainless steel crowns, pulpotomy, which are partial root canals. You're going to be told, why don't you just have a root canal? Why don't you just have an implant? I can't put in a composite in this filling because it's too big, so why don't we just put in a mercury filling? And there starts the beginning of your poisoning. Oh, here I did it again. You see, I just get so passionate about this kind of dentistry, and it's frustrating for me because in the whole field of dentistry there seems to be very little room for us to have a platform and to be able to say there are alternatives. There's a different way of practicing, and it's not for everybody, but it is for a fairly large percentage of the population. People who are thinking people who want to take and accept responsibility for their own health. That's who this kind of dentistry is for. So my vision and my dream is to have centers for healing all over the United States, where patients can go and know they can get this kind of dentistry. And if they're already toxic, they're already sick from fillings they have in their mouth, they know beyond a shadow of a doubt that those fillings will be taken out properly. That's my goal. And I know you come from Florida, right?
Yes, I'm from Florida.
So
yes.
Dr. Huguette actually travels up from Florida to Scranton every month so that she can have the privilege of working with our patients in Scranton office. And eventually we'll have one in Florida, and she won't have to do that. We'll see. Maybe she'll really get into skiing and she'll love being in Scranton. We'll see.
Who knows?
Yeah, who knows?
Who knows, yes.
So thank you very much. Thank you for sharing that with us.
Pleasure being here.
Continue to watch our videos because little by little you'll get to meet all of the doctors that have gotten excited about the concept of having centers for healing and the doctors who are committed to doing this kind of dentistry. Thank you very much. This is Dr. Huguette, and I'm Dr. Blanche.
Thank you for watching another installment of Today's Dentistry with Dr. Blanche Grube. The goal of our program is to educate you, the patient, in all aspects of the Huggins-Grube Holistic Dental Protocol and how it offers dentistry that is safe for the whole body. Educate yourself. Watch the other informative and new patient videos right here on our website. Then call for an appointment at Centers for Healing.